So, greetings of the day. Maybe due to some technical errors on two different meetings, and therefore probably you could not catch up with me. So now we are going to start this session, and now we are going to look at the sentence structure. As we discussed in the very first session, there are three criteria in OET writing which look at your ability to construct sentence. We discussed that the criteria which looks at overall task fulfillment. So overall task fulfillment looks at your ability to construct sentences which are appropriate in the context, construct sentences which are conveying the right kind of message to the reader. And it looks at your ability to frame the overall layout. That means the cohesion of your letter, your paragraphing. So your paragraphing, your way to connect sentences is looking at your ability to construct sentences. The second criteria that we looked at the other day was comprehension of stimulus material. So comprehension basically is understanding the case notes. But of course, even if you have understood it correctly, if you cannot put it into proper sentences, then it is going to affect your score. So comprehension of stimulus material, basically it is your understanding of the case notes, but the examiner will be able to understand, or examiner will be able to evaluate this criteria only if you have presented in well-framed sentences. Okay, so basically again, this is looking at your ability to understand and put it into the letter, put it in appropriate sentences. So if you are not good at sentence structure, obviously, even in this criteria, your score would get affected. And the third criteria was linguistic skills. So obviously linguistic skills, this is the main criteria which looks at your ability to frame variety of sentences. The criteria in OET is not only grammatical accuracy. Okay? It is grammatical range and accuracy. That means you should be able to frame variety of sentence structure with correct use of grammar. So if you have used all the correct grammar, but your sentence structure is monotonous, you have written all the sentences which starts with he or she maybe, they are all in either active or in passive, then you are likely to get less score. So you need to have a variety of sentence structure, and that is what we are going to focus on throughout this course. So to understand the sentence, you need to understand the basic element of a sentence, and then how you can connect those sentences using different conjunctions. So that is what we are going to look at today. Okay? But if you know why you are learning certain things, it becomes easier for you to implement it in writing. Okay? So I'm sure all of you are aware about these three elements of a sentence. It is, any sentence would have these three elements. It will have a subject. Subject means the doer, the one who is doing the action. It will have a verb and an object. And that is a simple sentence structure. Now, how you can make it a complex is through different ways, through using different kinds of conjunctions. Now, there are certain rules that you need to follow for the conjunctions that you use. So, before that, you need to understand what is a dependent clause and what is independent clause. if you understand this, it becomes easier for you to use all this conjunction, and it becomes easier for you to write, use proper punctuation for all of them. So, an independent clause is a clause that can stand on its own by itself, and it does not require another phrase or a sentence to make sense. So, look at this example here. It says he is worried about the possibility of colon cancer. So, this is a complete sentence, meaningful sentence, doesn't require another sentence to make sense. Similarly, if you look at this sentence, if you don't read because, and if you start reading from here, his father died of cancer. So his father died of cancer is a meaningful sentence, but if you say because his father died of cancer, then it sounds incomplete. Because what, so yes, well, what happened because his father died of cancer is an incomplete sentence. So it will require another phrase to make sense. So this is how a dependent clause is the clause that does not express a complete thought. It is not meaningful on its own. It will be meaningful only if you add another sentence with it. So dependent clauses must be joined to another clause in order to avoid creating a sentence fragment. So any independent sentence, if you add these words in the beginning of those sentences, they become dependent sentences. When you say before, after, because, since, in order to, though, although, even this WH word, whenever, wherever, whether, even while, or even though. Okay? In this list, there are two more words, due to and as. So whenever you use these words in the beginning of any of the sentence, that particular sentence becomes dependent. So only if you connect these two sentences, he is now worried about the possibility of colon cancer because his father died of cancer. That is when it becomes a complete sentence. So if your dependent clause is at the second position, or if the dependent clause is written after the main clause, this is main clause because it is independent. So if your sentence starts with independent sentence, and if you then connect dependent sentence, then there is no need to have any comma over there. Let me explain it to you this way. Okay. Because main clause can stand it on its own, and subclause cannot stand. So the subclause, that means the dependent clause, depends on the main clause. Okay. So by using conjunction, you can make either a complex sentence or compound complex sentence. So what is the compound sentence and what is the complex sentence? Today we'll be looking at mainly the compound sentence. So what is a compound sentence? Is the sentence which carries two independent clauses. The clauses which are both independent does not depend on each other to make sense. Look at this sentence here. He was initially walking with the aid of crutches, but now she can walk independently without any difficulty. So this sentence is independent, meaningful. This sentence is also independent and meaningful. But because they both are related to walking, I want to connect them. Now, if I want to connect them as a dependent sentence, then the tense in both the sentence has to be the same. But here that's not the case. Here she was initially walking. This is past tense. And she can walk. This is present. So if my one sentence is in past tense and one sentence is in present tense, I can't connect the next sentence as a dependent sentence. And therefore, I need to connect it as a complete independent sentence. And here, because there is contrast, here it says that she required crutches. Here it says that she walks independently. Therefore, I have chosen conjunction but. So when you connect two independent sentences using conjunction and or but, it is known as a compound sentence. You are connecting them because they are logically connected, related to each other. So there are three ways of connecting such compound sentence. One way is using a semicolon. Another way is using a coordinating conjunction, which is and or but. And third way is using a transition. Now, before I explain this to you, I would like to explain you what is a complex sentence. Or what is a parallel sentence? Look at this. She does not smoke, but is a very heavy alcohol drinker. So here she does not smoke is independent sentence, but is a very heavy alcohol drinker. If I read it from here, because but is my conjunction, is a very heavy alcohol drinker. If I read it this way, this is a dependent sentence. So this will be known as a complex sentence because it has one independent sentence and it has one dependent sentence. Now, why this is dependent? Because it doesn't have a subject. When I say is a very heavy alcohol drinker, it is not meaningful because you would ask who is a very heavy alcohol drinker. So that she is written here. So this sentence essentially is dependent on this she to make sense. But in this case, look at the tense. This is in present tense and this is also in present tense. So the two criteria that you need to follow to connect a dependent sentence or to connect it as a dependent sentence is that your subject has to be the same. So subject is the doer. So here for both the sentence, subject is she. And another criteria is your tense has to be the same. So in both the sentences, either it should be present tense or past or future. You can't have a combination of sentence in past and one in present. Okay. And
Continuation करूँगा. Korea. Korea. अभी continuation नहीं. Cricket के ऊपर भी वाला. Cricket problem दूँगा. वो नहीं हो सकता. I didn't know. मेरा तो नहीं चला. Connection.
okay, so if both your criteria meet, then you can connect it as a dependent sentence. So you can have such a sentence where you write, for example, she has had diabetes and takes metformin, for example. So here, because your has had is present perfect and takes is simple present. So that's not a problem. You can't say she has had diabetes and broke her left arm in 2016, for example. You can't have such a sentence because Here, the tense is different. Has had is present perfect, whereas this broke is simple past. So be careful when you are connecting your sentences. You need to be careful. Okay. So when you have such cases where you have two different tenses or when you have two different subjects, that is when you frame a compound sentence. Because here you have no restriction of tense or you have no restriction of subject. Similarly, if I write a sentence like this, she, for example, when I checked her at 10, she appeared to be, for example, she appeared to be cyanotic and her blood pressure was, say, 80/60. So look at this sentence here. It says, when I checked her at 10, this is a dependent clause, then she appeared to be cyanotic. So for this sentence, your subject is she, and here is her BP. So logically, if you think from a medicine point of view, you might think that her BP and she are the same. That they are not two different things, right? Because it is her blood pressure. But if you think it from language point of view, they are considered as two different subjects. Because this appeared to be is for she and was 80/60 is for her BP. So therefore, in that sentence, again, you need to connect those two sentences as independent sentences because they are essentially two independent sentences. Her BP was 80/60. This sentence is not dependent on this. Neither this is dependent on the other. So they are both independent sentences. So you frame independent sentences only when your two criteria meeting, whenever you have two sentences which you think are logically related to each other. So you need to put it in one compound or complex sentence, but then you realize that your subject is different and you realize that maybe they are both sentences are in different tenses. So that is when you decide to frame a compound sentence. And then there are three ways. The one, as I told you, is to connect it using a semicolon. Look at this example. Okay, this is the format. An independent clause, then you have this semicolon and another independent clause. If you think that there are too many of and in your letter, and if you don't want to repeat and again, then without using any conjunction, you can simply connect it using semicolon. So there are certain rules again which you need to follow. If you are connecting it using semicolon, that means one single sentence. So the letter which starts after semicolon is in smaller case. Excuse me. So you don't need to make it capital. And as I told you, they are both independent. So I can't start after semicolon, I can't say was referred to quit line. I need to have a complete sentence. She was referred to quit line. Okay, and then I need to connect it using semicolon. Another way is using conjunction. That means I can use and, or but. They are three most commonly used conjunction. But when I use it, I need to have comma before it. Okay? So she appeared distressed and sweaty, comma, and her blood pressure was elevated. So here it is she, here it is her blood pressure, and therefore two independent sentences. And the third way is using any of the transition. Okay, transition such as however, in addition, therefore, whatever is suitable in that context. So again, if you are connecting two sentences using a transition, you need to have a semicolon before transition and comma after transition. And the sentence which starts after comma has a lowercase. Even here, the transition has a lowercase because it is written after semicolon. So semicolon, wherever it is, the sentence is still continue. It is not a new sentence. Another way of writing this is I can do her condition has improved, full stop. And I can start a new sentence with however, she is still very weak. Okay, so these are the three different ways through which you can write compound sentences. And these are the conjunctions which you can use. An easy way to remember them is fanboys. But as far as OET writing is concerned, you would be most probably using and, or, and, but. Because so is considered as spoken expression. It is more often used in spoken language than in written language. So as far as you OET writing is concerned, you would be most probably using and, or, and but to connect sentences. Of course, you might be using for as well, but it is not to connect sentences. It would be most probably to connect words. So do not use a comma every time you use the words and or but. The comma will be required only when this but is followed by a complete independent sentence. So here there is no comma because it is not an independent clause. Okay. So is it now clear when to have comma before and, but, and or? Only when you are connecting two independent sentences. Okay, so what is a complex sentence then? Okay, so a complex sentence is a sentence which will have two or more clauses. In compound sentence, you have two independent clauses, but in complex sentence, you can have more than two clauses. And that is why it is very, very popular in writing because it helps you to continue the same sentence without having the need of starting a new sentence. So when you have a complex sentence, essentially you will have one main clause, which is your independent sentence. And then you have multiple dependent clause, which are joined with a conjunction. So look at this here. This is exactly how you might be feeling right now, right? You should stop, ma'am, because I'm getting mad because too much of, the complexity in it. But if you try to simplify it, understand it this way, that if you have two independent sentences, it is a compound. If you have just one independent sentence and multiple dependent sentences, it is complex because it has more than two phrases. So look at this example. She is now worried about her condition due to her increased weight. So here you have one independent clause. She is now worried about her condition. It is meaningful. And due to her increased weight is dependent. Because if I just say due to her increased weight, it is not meaningful. So there are different conjunctions that we use to make complex sentences. There are conjunctions for reason, there are conjunctions for purpose, there are conjunctions to show contrast. So that part will continue in the next session. Okay, today the main aim was to understand what is dependent clause, what is independent clause, what is compound sentence, and what is a complex sentence. We also looked at 3 ways of writing compound sentences. Now, in the next session, we'll continue the same and we'll be looking at complex sentences and different types of complex sentences. Okay, so now we are going to look at the writing task. We'll be looking at a complete case notes and a model answer. So this is the third session in the series, and the writing task which we are going to look at today is writing task number 5 from the PDF which I have sent to all of you. And this is writing to the patient's GP. So though there are 3 tasks in it, we are particularly going to look at the task which is being written to the patient's GP and Simon's. So if we understand the case notes now, Miss Alison Watson is a patient in medical ward of which you are charge nurse, admitted after near drowning. And now the letter is being written to the patient's GP. This is the most common type of letter which is seen in OET writing. Most of the letters are either writing to GP or it is to the patient's GP. So if it is given GP, it means it is probably a new reference. If it is given patient's GP, it means that your purpose there is to update them on the current hospitalization. And your purpose is not to tell them about the medical and social history. So whenever it comes to writing to the patient's GP, your focus is mainly on what happened during the recent hospitalization, because if they are patient's GP, you can expect them that they know about the patient's background medical history, they know about the social history, and they know about the patient's overall well-being or health, but they are not probably aware about the recent hospitalization. Still, when you are looking at a particular task, you should evaluate it carefully in order to decide which things do you think might, which things do you think the GP might not be aware about. So here it is given that the patient is 6 years old and was admitted on 21st Feb, discharged on 3rd March. Most of the students do not look at admission and discharge date carefully. They just use it to put the dates. But I think it is a very good indicator of understanding the patient's progress. If it is a fairly short stay, you understand that it is a normal recovery. But if you look at the admission and discharge date, and if you look at the time period, if you think it is more than 1 month, it helps you to understand that probably there were a lot of complications. So look at admission and discharge date for your understanding. It will give you a clue about the patient's recovery. Near drowning was the diagnosis, and the patient had potential hypoxic brain injury. Though social background and medical history is given, as I told you, it is our purpose here is not to write about the background medical history. So the current history is that she fell into freshwater lake and then was found 15-20 minutes later, and then paramedics arrived 10 minutes later. Basic life support was given, and on admission, these are the symptoms that she presented. So what was done about it is she had CPR, then she was on ventilator, humidifier, and the initial ABG was this with only 78% arterial saturation. But after CPR, spontaneous circulation was achieved. So this is giving the information about the patient's condition initially on admission and what treatment was given to her on admission. Then the case notes usually will have a record of the treatment that was given throughout the patient's stay at the hospital. Now, of course, during that particular time period, those important informations may sound important, but think about a situation when the patient is being discharged, say, for example, after 10 days of hospitalization. So, in that case, not everything that happened in the hospital will be required in your answer. You may not include everything. There is no need to include every single date, but you will be writing the overall progress of the patient. So here the initial treatment was given to the patient, and after 2 days of treatment, it is that the blood pressure was a bit stabilized, the temperature has also stabilized, patient is stable, and was even ABG has improved. So the patient was transferred to general ward. So if we now go to the answer, it will be possible for you to understand how the case notes were transformed into a letter. Okay, so I'll just bring that answer on the screen. This is the initial account. Okay, the case notes that we have read so far. On 21st Feb 2016, she was brought to the hospital around 30 minutes later or 30 minutes after she had fallen into freshwater lake. So I have put 3 to 4 bullets into one sentence. Because whenever you are writing an OET letter, your purpose is not to convert each bullet point into a sentence. Your purpose is to understand all those bullet points and transform it into a compound or complex sentence. So she was brought to the hospital around 30 minutes after she had fallen into freshwater lake, because it is given that after 20 minutes she was found, and then within 10 minutes the paramedics arrived and then took her to the hospital. Initially, so instead of using the date again, and because I'm not telling her situation only in the beginning, I'm saying about the not only on the same day, but I'm saying about the initial period. So instead of using on admission, I have used initially. Initially, she was hypotensive, cyanotic, and unconscious, and required mechanical ventilation as well as a warmer. So here it is a parallel sentence. Look at this. She was hypotensive, cyanotic, and unconscious. This is one main clause. And required mechanical ventilation. So required mechanical ventilation is dependent clause because it doesn't have a subject. It is dependent on this she to make sense. So this is entirely one complex sentence connected using a conjunction, however, with another independent sentence. However, now she is breathing normally and her vital signs are within the normal range. So here again, because here she was past tense, now she is present tense. She is breathing and her vital signs. So again, these two are independent sentences. Therefore, I need to have comma before and. So this is how you transform the case notes into a paragraph, not converting each bullet point into a sentence. So now if we look at the another further case notes, because it is, we have already covered this part into our letter that she's breathing normally and her vital signs are stable. So this is what it is given. And since she is moving around the bed, no longer hyperventilated, weaning of mechanical ventilation begin, and temperature is normal. But this is a typo here, moving around the bed. It is some mistake in the typing because here it is given unresponsive to command. So obviously cannot move around the bed. Okay, so this is a typo. Then in the next 4 days, responsive, she started communication, but also still has slurred speech. So speech therapy was commenced. This is the standard way of writing the case notes. Initially, they will present a few problems, then what treatment was given to them, then gradually those problems resolve. And as you move forward, some new problems come up. So by this date, all the previous problems had resolved. Now, here, though all the previous problems resolved, including her response to commands, she developed a few new problems, right? She developed slurred speech. So speech therapy was required. She developed difficulty in concentrating. So paracetamol, difficulty in concentrating. Along with that, she had some headaches. So paracetamol was prescribed. She developed coughing, cough, and along with pink sputum, naturally because on mechanical ventilation, so because of that some sort of coughing and sputum is quite obvious. So by this date all the previous problem had resolved, but then she developed a few new problems. So what was done about them? So speech therapy was given, so now her communication is improving, but she still has some slurring. Her concentration is improving. Neurological exam is clear, but she needs more tests. Parents are concerned about permanent speech and cognitive effect because she had slurred speech at the age of 6, which is of course a matter of concern. And about the cognitive effects because she had difficulty in concentrating. She also has occasional cough and paracetamol for headache, but she is now ready for discharge. So if we look at the model answer again, as to understand how this case notes were transformed into paragraph. So whilst in the hospital, now this paragraph is describing the treatment that was given to the patient in the hospital and further issues that the patient developed. So basically the patient's progress. So whilst in the hospital, she suffered from slurred speech, headaches, and impaired concentration. So she suffered from these 3 things: slurred speech, headaches, and impaired concentration. This is how you write a complex sentence, because if I had said she had slurred speech, she experienced this, or and her concentration was impaired, it will become 3 sentences. Instead of that, I converted all those issues into a noun or a noun phrase. So she suffered from slurred speech, headaches, and instead of saying her concentration was impaired, it is impaired concentration, and developed cough with pink sputum. So here I could have said, impaired concentration and cough with pink sputum. That way also it is possible, but I decided to write a new sentence because cough was something that she developed during hospitalization. So again, this is a parallel sentence. She suffered from and developed. Both the sentences have same subject she, and they both are written in past tense. So there is no comma before and here because I have connected a dependent sentence. Though her cognitive ability and speech are now improving, appointments with a neurologist for further cognitive test and with a speech therapist for continued speech therapy have been arranged for further management. So this I included here because this is something for which I'm not writing to the GP. For her difficulties in concentration, it is the neurologist who is going to carry out further investigation, and her difficulty in speech is going to be managed by a speech therapist. So I did not elaborate much on it. I have just mentioned about it and what is done about it. So there is this sentence with though. Okay, though is used to say that something is more important than the other. So though her cognitive ability and speech are now improving, it is on the better side, improvement side. But the main point I want to make here is that appointments with a neurologist and speech therapist have been made, and why they have been made: for further cognitive test and for continued speech therapy. So this is to inform the GP about what problems did she face in the hospital and what treatment has been given to her so far. So if we now go back to the case notes for the discharge plan. So as it is to the patient's GP, naturally it is not for here, it is not for further investigation. It is very clearly given that she has to take paracetamol for headaches. She has to return to the hospital if she has cough. Speech therapy is to be continued. Neurologist is going to conduct further tests. I have not given the name of this test because again it is the neurologist who is going to conduct. So this is not the purpose for writing a letter to the GP. But GP is mainly to check cough and headaches. Whenever you are looking at a discharge plan, always consider it that the discharge plan is for you as a nurse. You have designed this discharge plan. When the patient is being discharged, what all things you are supposed to do. And it is not everything that you need to write or request to the person you are writing the letter to. It will be very clearly stated what are they supposed to do. So speech therapist would continue the speech therapy. Neurologist will carry out further tests. Reference to the GP is mainly for cough and headaches only. And of course, when you are writing a letter to the GP, it's very different from community nurse. Because of course, community nurse will be visiting the patient on a daily basis, and they might be observing the patient on a daily basis. They might be assisting with a few things. But when it comes to GP, they are mainly responsible for maybe seeing the patient alternative day or maybe once in a week. So you can't tell them to observe their vital signs, okay, because they are hardly going to see the patient once in a week. So it is something that usually the parents or the relatives of the patient would do, and they are instructed to contact GP if they have any issue, which is very clearly stated here. Parents to monitor cough and headaches as well as concentration, and call doctor if minor issues, and bring to ER if severe. So of course, GP is there for the cough and headaches, but he is not someone who will be with the patient 24 hours. So we have instructed the parents to monitor it. And then parents have also been instructed to contact the doctor if they have any issues, if the girl has any issues. So that is the basic difference between writing a discharge summary to a community nurse and to a GP. If it is being written to a community nurse, there might be a lot of things that you are requesting the community nurse to do. But when it is written to the GP, your main purpose is to tell him about the hospitalization, and you might be requesting them to carry out maybe some further investigation or follow up blood test, or you might be requesting GP to monitor the dosage of certain medication. So that's the difference. So here it is very clearly given the only reason why we are writing to GP is for cough and headaches, and about the treatment that patient had in the hospital. Okay. So that forms our last paragraph. My main concern is that she still has occasional cough and headaches, for which she has been prescribed with Panadol when needed. In view of the above, it would be appreciated if you could monitor her cough and headaches. Please note, her parents have been informed to contact you if they have any concerns. May I also remind you that she has had mild asthma. Now, because here the patient's complaints are related to asthma, cough, and headaches, mainly the cough, that is why I have used this phrase. Usually, when it is to the patient's GP, our purpose is not to inform the medical history. But if you think that their medical history is significant at this point, then you can use such a phrase. May I also remind you? So we are not informing him. We haven't said, please note he has had or she has had. But because they are patient's GP, we are assuming that they know it. So may I remind you that she has had mild asthma. So that is how you frame the sentence. And that too in context, because I haven't said in terms of medical history. Because again, the overall purpose of me writing this letter is not to inform him about medical history. Okay. So overall task fulfillment is this: when you understand what is the main purpose of writing this letter, and you show it throughout your letter. So I have not elaborated much on uh, the neurological examinations. I have not elaborated much on the speech therapy, but yes, I have briefly explained him what all issues did the patient face and what all overall treatment arrangements have been made for the patient and how was the overall progress. Okay, and this is how my introduction paragraph is. Because I'm writing to someone who already knows the patient. So I've used such a phrase. I'm writing in regard to Allison, a regular patient of your practice. Who was admitted to Wasman Public Hospital with possible hypoxic brain injury. Following near drowning. So first she had near drowning, and then probably we are suspecting that it can be hypoxic brain injury. So I have used such a phrase, admitted with hypoxic brain injury following near drowning. Though her progress has been satisfactory, further care and monitoring will be required to ensure complete recovery. So far, she has made good progress. Her concentration has improved, her speech is improving, and other things are settled. Her neurological examination was cleared. So overall progress has been satisfactory. But we are still requesting the GP to monitor headaches and cough. So while designing the introduction paragraph, there should be three things very clearly mentioned. One is what is the patient's diagnosis, the reason for admission. Second is what is patient's current condition, especially if it is a discharge summary. Because maybe the patient when came into the hospital was unconscious, but now the patient is conscious. So this sentence, though her progress has been satisfactory, is giving you information about the patient's overall progress. Now, third reason is your purpose for writing the letter in brief. So further care and monitoring will be required to ensure complete recovery. This is your purpose. So you don't write exactly what monitoring and what care, because it is just brief. The detail will be written in the last paragraph with specific investigation, what is to monitor for. So purpose of writing will always be mentioned twice. Once in the introduction paragraph in a brief sentence, and the last paragraph will have it in detail. So that is how this letter to the patient's GP are to be written. Now, the assignment that you are going to do for this particular task is writing number 6 from the PDF. It is again writing to the patient's GP. So now, because you understand the structure, it will become easier for you to address this task. Okay. So send it through on the email address which I have provided. It is writingcorrection@oetacumen.com. Okay, so all of you are supposed to send the writing task in Word file, and that Word file should have your name on it so that I understand whose task it is. So that's all from today's session. We'll have the next session for writing on Wednesday at same time, 2 o'clock Indian Standard Time. Okay.